College. I want to welcome everybody to our Fall Health Careers Symposium. I was at the Regional Medical Center this morning, as a matter of fact, and talking about ways in which the college can partner with the hospital to help meet their workforce needs. And given the current environment that we're in, I think the health careers programs that we offer have always been important, but are even more critical now. And so our goal really is to work towards preparing a qualified workforce that will enter into health careers at the college in hopes of providing a high quality level of care to their patients. Our programs have been and continue to be ranked nationally because of the success of our students and the success that they have had on licensure pass rates. And so this is an opportunity to learn more about the careers that we prepare folks for in the health career area in hopes that you might join us at some point in the future. Next on the program is Jalacey Green. So Jalacey, I will turn it over to you and welcome.
Awesome. Thank you so much, Dr. Tobin. Good morning again, everyone. I'm Jalacey Green, the Health Careers Program Coordinator for Low Country Area Health Education Center. And this event is for the B2B 2.0 Bio 126 course and is in collaboration with the Orangeburg Calhoun Technical College, Denmark Technical College, and Low Country AHEC. The Health Career Symposium activity is designed to provide pre-health undergraduate students an opportunity to meet and network with practicing health professionals, health education faculty, and/or students who are currently enrolled in the health professions education. Students, at the conclusion of this activity, you should be able to network with practicing health professionals, discuss the work environments associated with a variety of health professions, and today you're being provided with the opportunity to network with professionals representing a variety of health careers. So your goal today is to gather enough information to answer any questions that you have about the health professions represented and their role in the delivery of healthcare. Now we are going to begin our symposium. First, we have Dr. Matthew Geary for physical therapy. He is the Director of Clinical Education and Assistant Professor at Charleston Southern University. Dr. Geary.
Hi, good morning. Thank you for having me. Am I good to just go on ahead?
Yes, sir.
Great. So there's a couple questions that I was asked to address and topics that I was asked to address. So first, just kind of why I chose this selected career path that I did. A little bit of background about myself. Physical therapy is actually a second career for me. Out of college, out of undergrad, I actually built houses. So quite a change. Some of you may be too young to remember the recession of 2008 and the housing market crash, but whenever that came around, my work as a home builder started to suffer. So at that point, I looked at going back to school, and I knew I wanted to do something with healthcare. I looked at it as having good job prospects, a chance to, earn a decent wage. I definitely enjoyed working with people, and I like the idea of helping people. I'm also a firm believer that we should build our skill sets. So I looked at going into the healthcare field as, something barring any catastrophic injury, no one's going to be able to take those skills away from me, the skills that I learned in school. So I was looking at going either to school to be a physical therapist, or I was looking at a career as a physician assistant. I had done my research and both had promising job outlooks. Both were growth industries. And I won't bash the field of PA by any means. It's a wonderful field. It's a great job. I would encourage you guys to look into that as well. But for me, physical therapy allowed me the opportunity to spend a lot of time with my patients and to get to know them. I know we've all been to the doctor and you see them for 5 minutes and then they're out the room and they're in a rush, and we don't really sometimes feel like we get a lot of time to speak with them or tell them kind of what we feel like is going on. So as a physical therapist, I might see patients anywhere from 30 to 60 minutes at a time, 1 to 2 times a week, sometimes for up to a few months. So that what I saw there was the opportunity to really get to know patients, understand their hardships, understand their struggles, and really be able to apply more of a holistic approach to their rehabilitation. So all that being said, what is physical therapy exactly? The Bureau of Labor Statistics, they say physical therapists evaluate and record a patient's progress. They help injured or ill people improve movement and manage pain. They're often an important part of preventive care, rehabilitation, and treatment for patients with chronic conditions, illnesses, or injuries. So a lot of words there, a lot of verbiage. The APTA, which is the American Physical Therapy Association, is not much better. They say we're movement experts who improve the quality of life through prescribed exercise, hands-on care, and patient education. A little bit better, a little bit more concise, but to really what I would say we do is we help patients with functional limitations. Maybe they have strength deficits, maybe they have mobility deficits, maybe it's pain that is the primary limiting factor for them. But regardless, they have limitations in their function. And so physical therapists help them restore their function, prevent disability or adapt to disability, and get back to functioning in their daily life. There's kind of two tracks that you can take in physical therapy. You can either be a physical therapist or a physical therapist assistant. So what is the difference there? A physical therapist is a doctoral profession. So you go to school, you get your 4-year degree, and then you go to PT school and you get your doctorate in physical therapy. That takes typically another 2.5 to 3.5 years, depending on the school. Physical therapist assistants is typically a 2-year program. Orangeburg Technical Colleges offers that program. I'm not as familiar with Denmark Tech, but many technical schools offer it. You work in a variety of different settings. You kind of typically choose the setting that you want to work in, but that can range from an inpatient setting to an outpatient setting. By inpatient, I mean like at a hospital. You might work at a step-down setting like a long-term care facility or a skilled nursing facility, something like that. Some therapists work in patients' homes, and others like myself worked in an outpatient setting where I was at an office and patients came to see me there. The setting will kind of dictate the type of patients you see. Typically, the more acute settings, the patients have increased levels of dysfunction or complexity. So for example, in a hospital, that patient might be on a ventilator helping them breathe, or a feeding tube, or have IVs connected to them. As such, the interventions that you do, the treatments that you do are probably going to be a little bit seemingly less complex. So they might be doing exercises in the bed. You might just be helping them stand up or helping them walk. And then that may be the extent of the therapy. Conversely, patients in an outpatient setting where they come to you, they're typically further along in that rehab process. So you don't have to worry as much about emergency response or that patient coding or something like that. But with that, the patients are typically a little bit further along that process. And so you're able to do a little bit more advanced interventions with them, advanced exercises. Even in an outpatient setting, the type of patient that you see can vary greatly. Some might be post-operative. Maybe they had a shoulder surgery or a back surgery, something like that. Still have a lot of limitations. Some might be highly functional athletes trying to improve performance. Some clinics specialize in pediatrics or treating children. Some clinics specialize in geriatrics, treating an elderly population. Many outpatient clinics see a wide range of patients, though, with a wide age range. So I would see, maybe somebody as young as 10, as old as 100. Exercise is typically kind of the bread and butter intervention, bread and butter treatment that physical therapists use. Again, that level of exercise can vary greatly among patients, though. Some therapists will specialize. So they might use certain techniques that are based on movements or certain movements. Some are more like a manual therapist, like myself, where we use a lot of hands-on techniques. That might be what we call a manipulation, or like cracking someone's neck or cracking someone's back, something like that. Joint mobilization, where we use our hands to physically move a patient's joints. Massage or soft tissue techniques, or something called dry needling that looks a lot like acupuncture, if you've ever seen acupuncture on TV or something. And I'm actually going to demonstrate that for you a little bit. Typical workday as a PT largely depends on the setting. For PTs, it's kind of a balance between evaluating new patients and establishing a plan of care for them. So that's determining, the frequency and the length of that rehabilitation plan, deciding what interventions you think are going to be appropriate. This involves a lot of learning about the patient's past medical history and balancing that with the reason that they're there for PT in the first place. Could be they underwent an amputation, could be they just had surgery, could be a simple ankle sprain over the weekend, playing basketball. It might be a chronic issue where they've just had knee pain for years and they're just tired of dealing with it. So that's for a physical therapist. A physical therapist assistant, they will treat patients based on the plan of care established by the physical therapist. Other than seeing new patients and doing that new patient evaluation, a typical day for a PT and a PTA are fairly similar. You get to work, you review your schedule of patients, you may do a chart review where you look at their medical history or their previous visits. Some therapists plan their day a little bit more than others. Some, kind of typically work on the fly and, just kind of take it as it comes. But regardless, you're trying to help patients overcome those limitations, strength deficits. They're not very flexible. They have poor balance. They are dealing with pain. They have trouble with mobility, moving around, or transfers, like getting in and out of the bed or in and out of a car, in and out of a chair, something like that. And you're trying to help them improve their function. Things have changed a little bit with COVID, but not as much as you would guess. Physical therapists are considered essential workers, so a lot of them are still out there working. Maybe there's been an increase in precautions taking. We wear masks and goggles sometimes, or increased frequency of hand washing, maybe increased sanitation, that sort of thing. But typically, we take sanitation and cleanliness pretty important anyway. So we're always washing our hands in between patients, or cleaning down tables or mats that a patient is sitting on in between patients anyway. The biggest change that I've seen is going from more of a one-to-one treatment model to where it's one therapist and one patient, as opposed to previously, sometimes you would have some overlap where a therapist was seeing multiple patients at the same time, or group treatment sessions. And then the other big change is the implementation of what we call telehealth. So that is basically like a Zoom call between a therapist and a patient, where you can do a follow-up or initial evaluation, where you can kind of get some of the talking parts out of the way. But other than that, treatment hasn't changed a whole lot. I told you guys I was going to show you what dry needling look like. So this is what we call a dry needle. An acupuncturist would call it an acupuncture needle. I don't know if you can see that. This plastic tube here is just for protection. This is a clean needle. I just took it out of the wrapper. We could stick this in a muscle and a joint. It is a penetrating needle. I'm going to do this to myself. So it's just a little tap. We stick the needle into a muscle. What this does is can help reduce pain, help reduce tightness, something like that. In and out, no bleeding. It's a very skinny needle. This is not typically something that a PTA would do, but depending on the state, your practice can change a little bit. And so that's the biggest thing to look at whenever it comes to PT or PTA. It varies by state who does what, or who's allowed to do what. South Carolina will be different from North Carolina, and et cetera. I think that's about time. I want to open it up for any questions.
Sorry, I had to unmute myself. Thank you so much. I apologize for not failing to mention in the beginning, but students, there is a Q&A answer box that you could type your answers in. If you have any, questions, if you have any questions for Dr. Geary, now's the time to to have those questions, make those questions available to him.
I'll put my contact information in the chat as well. So if anybody has some questions later, or just looking for some information on kind of how to get into PT school or that sort of thing, feel free to reach out that way too.
We have a few questions coming in. One is asking, how challenging was the school aspect of things for you switching from construction to a field of physical therapy?
That's a great question. So I actually had to go back to school and take some prerequisites prior to going back to PT school. I already have my undergraduate degree, but it had been several years since I was in school. So I went to school for about a year and a half. I'm from Charleston, so I went to Trident Tech and took several science courses that were part of the prerequisites to get into PT school, and also just to kind of help get me back up to speed in terms of some of the basic foundational sciences. PT school itself is challenging. PTA school is challenging. Just because it's at a tech school does not mean it's easy by any means. And I would say that some PTA schools are very strict and they're very big on professionalism. PT schools are too, but from what I've seen, I've been very impressed with the PTA programs in terms of the preparation that they put their students through and the rigor of the programs to make sure they're prepared for the profession.
We have a few more. We have some great responses. Another is, why was the term dry needling used instead of acupuncture? Also
a great question. So in South Carolina, we have the LLR, which is the licensing and registration. They handle licensing and registration for professional careers, professional occupations. So acupuncturists own the term acupuncture in South Carolina. Physical therapists own the term physical therapy. So an acupuncturist cannot go and say that they're practicing physical therapy, just like a physical therapist can't say they're practicing acupuncture unless you're a licensed acupuncturist as well. So dry needling is kind of an umbrella term. I would say dry needling and acupuncture are kind of cousins. But that's one reason. Another reason is kind of the reasoning behind we do what we do is a little bit different. So I don't actually practice acupuncture, even though I stick needles in people, more because of the reasoning behind why I'm doing it.
Another is, can you choose to just be in like a juvenile setting or a pediatric setting?
Definitely, yeah. So a lot of people just work at a pediatric clinic where they only work with kids. Some people work in a hospital where they're only working with, cancer patients or cardiac patients, where people are, had heart surgery or something like that. It's very much a career where you can specialize and find your niche.
Another question is, do you recommend going through a PTA program before you work on that DPT?
That is an option. Some people do that. There's a couple of programs. There's two of them in the country that I know of that are called bridge programs, where they actually have an option to, if you are already a PTA, you can go there and transition that to a DPT. It's not required. I don't know that I would recommend doing it that way. Maybe if you feel like you just want to kind of get your feet wet in the profession and see how you like it before you commit to all that schooling, it might be an option. But a lot of places offer students the opportunity to come in and observe, like I did before I decided to go to PT school and apply to PT school. So I'd already spent probably 100 hours in a PT clinic working as an aide and helping out and observing before I ever even applied to PT school.
Awesome. Well, thank you so much for participating this morning. We have to go into our next speaker. I will send an email out, a follow-up email, thanking you again for your time this morning.
Great. I don't know if they can see the chat function, but I'll put my email in there if they have any other questions.
Okay, awesome. Thank you.
Thank you.
Next we have Ms. Candace Tooley for nursing. She is the Dean of Nursing and Health Sciences at Orangeburg Calhoun Technical College.
Good morning, everyone. How are you? As you said, my name is Candace Tooley. I'm the Dean of Nursing here at Orangeburg Calhoun Nursing and Health Sciences here at Orangeburg Calhoun Technical College. So good to see you. So I'm going to tell you a little bit about nursing. Nursing is a rewarding career. You have the ability to take care of patients and make changes in their lives, to assist them to get better, or to learn more about their own health and how they can better take care of themselves. So it's a great job. Now, I didn't decide to go into nursing right off the bat. I tried wiring houses. I've tried doing computer work, and that didn't work. And I actually was working at Hughes Aircraft, and they paid for you to go to school for a year after they had a layoff. And so I took that and I decided to come into nursing. And I came into the LPN program here at Orangeburg County Technical College, took that, then went immediately into my associate degree, and then continued on with my bachelor's and my master's. So I had like 10 years of school there. I didn't start nursing until I was 28 years old. So you can start at any time. You can start right out of high school. You can start middle age. And we have people in our nursing program now that's 60 years old. It's really, you have a wide opportunity of jobs. There's so many things that you can get into. You have telemarketing you can do now. You can work from home for insurance companies. You can work in a hospital. You can work in a doctor's office. You have dialysis clinics. There's just a vast amount of opportunities for a nurse out there. The thing is, to be a nurse, first of all, you want to be honest. You want to be compassionate. You want to care about other people. And when you are a nurse, you want to be competent in your skills and the things that you, the care that you provide to your patients. We function under the State Board of Nursing, and we follow the Nurse Practice Act. Now, with the Nurse Practice Act, it's broken down to whether you are a LPN or an RN or as nurse practitioner. So it has all of your laws, and it is a job where if you do not follow that law, that you can get in trouble. So you want to make sure that you know your Nurse Practice Act. So what does a typical work day look like? A typical work day depends on your location. As I said, there's so many jobs out there. If you go to the hospital, you can expect to work 12-hour shifts. You can expect to have 6 to 8 patients to take care of. Some of them may be, they're all acute if they're in the hospital, but then some of them may have drips and different things that you have to monitor more closely. They could be on a cardiac monitor. The good thing is you can specialize. You can go into labor and delivery. You can do pediatrics. You can do medical surgical. You can work down on the surgical unit, actually in the operating room, the recovery room. You could be a social worker, case manager at the hospital. So there's a lot of different things that you can do in the hospital. Like I said, usually your shifts are about 12 hours if you're on the floor. So it can make for a long day. But usually you work 3 days, and some of the hospitals let you decide your own schedule. Your schedule has to be made out like 6 to 8 weeks in advance. Then you could be a school nurse. Good thing about a school nurse, you can just be a nurse for 9 months, and then the 3 months off you have for the summer. If you have kids and things, that really works out good. Doctor's offices are usually Monday through Friday, 8 to 5. Half a day on Fridays. So there's a lot of different opportunities for you out there. So where do you want to begin? You can start off like I did as an LPN. You can start off as an RN, or you can go ahead and start in a bachelor's program. And it just depends on where you want to start. And you can go all the way up to be a doctorate in nursing. So there's a lot of things you can do as your education and the careers out there for you. If you work in dialysis, you usually have to be there at 5 o'clock in the morning, because you have to mix chemicals and do different things like that. So again, it just depends on the career that you choose. And as a nurse, once you receive your degree, let's say it's an LPN. LPNs typically can't push meds or anything like that with IVs. So if they can't push meds with an IV, in dialysis, a lot of times the patients need, specific medications that need to be given IV. Well, if you go back for extra training, which the dialysis clinic will send you for, then you can do those types of things. So there's even specialized certifications that you can obtain to so you can do more things. But with the LPNs are typically bedside nursing. They give them medications, they provide patient care, change dressings, those types of things. And then you have the registered nurse. The registered nurse, the LPN works under the registered nurse. The registered nurse is the ones that do the plan of care for the patient. They do the assessment and say, this is what we need to do for this patient, the interventions we need to do, the assessments we need to do, and those types of things. And then the registered nurse and the LPN, of course, work under the physician that's caring for that patient. So how has COVID-19 pandemic affected our profession? Well, it's affected a lot of things because none of us were prepared for the pandemic. We didn't have all the supplies that we needed. And OC Tech worked with the hospital and we gave them some of our items and supplies to be able to help out our peers across the street. We didn't have all the personnel, and people were scared to go back to work because of COVID. You have a lot of people that said, "Oh, I don't know." About 87% of the people said, "I don't want to go back to work. I don't want to expose myself to that and then take it home to my family." But you are a nurse, and as a nurse, you are an essential worker, and you took that oath that you were going to help to take care of these patients, and when they're sick. And so, nurses are putting in a lot of hours right now. They're taking on extra shifts. They're tired because they're working so much, and watching so many people deteriorate has really been depressing for them, because nursing, as I said, you have to have that compassion for others. Some of the jobs are paying the nurses a little bit more, some even up to $25 more an hour, because they're taking care of COVID patients on a COVID floor. And so so it has been beneficial for them, pay-wise, but still, it can still be a very perplexing thing to have to do. Increased safety precautions. You have new protocols in place because nobody knew what to expect, what COVID was going to do. It started off as being airborne and then with fever and things like that. And then all of a sudden, the signs and symptoms of COVID changed, and you really don't know what signs and symptoms people with COVID have. And so you may, with our nursing students, when we put them in the hospital, we say you can't take care of a COVID patient. But however, we did assign patients, and they were not COVID patients. They came in with another diagnosis, but was eventually diagnosed as being COVID. But in the clinical setting, even with our students, we have them N95 tested. That's the mask that you have to wear to protect yourself. We have them protected. They wear a face shield. So they are very cautious and with taking care of the patients. So some disease disorders have certain protocols you have to follow. We had no protocol for COVID. We were just playing it by ear as we learned more about the disease process. Most of the hospitals, or all of the hospitals and the nursing homes, restricted families from coming in and spending time with their loved ones, even the ones that had COVID. They was very, very rarely would they let anyone in. And so you had these individuals that were dying alone. And so that can be wearing, that can be very distressing for nurses, and to watch loved ones die alone. How did it affect us here as far as education? All of our classes went online. We had to pull our students out of clinical. And so then we had to go to virtual clinical because the hands-on skills, what you really need. And so OC Tech did a great job with keeping our students prepared and keeping them moving forward in their program. So due to the need of licensed nurses, we have the enhanced nursing compact licensure, which if you come to OC Tech and you take our courses, you take the NCLEX, which is the exam that you have to take to be licensed. And so with that, some of our students, it was delayed. They were not having testing. And so a lot of our students that did graduate, they had to wait 2 or 3 months, even 4 months before they could get a testing date in. And so that effect is how it affected our programs, which meant it decreased the number of nurses that was out there on the floors. So some of the nursing restrictions was lifted way back when. When you graduated, it would take you 6 weeks to get your license. And so they had a graduate nurse certificate that you could take into a job, and you could work and still be trained until you got your license. Well, they kind of went back to that. You had to apply for it, but they kind of went back to that so we could get more nurses out there. You have more nurses that were wanting to leave because of the pandemic, that retire early because of the pandemic. So a lot of things had to change with nursing due to the COVID-19. But with all of this going on, there's a lot of new things that are coming out, and you're going to see new professions for nursing. You're going to see more opportunities for nursing in the telemarketing world. And so again, with this new pandemic, it was not good for us, but there's going to be a lot of new emerging technology and protocols and jobs available for nurses. So I guess now I have time open for questions.
Dean Tooley, we have a question if there have been any programs developed to kind of help nurses through this pandemic.
Any programs developed to help nurses through the pandemic?
Yes, ma'am. I'm wondering if they're asking maybe about support programs or additional education.
Well, all of the programs across South Carolina or across the world has had to implement new programs and stuff for the nurses so that they would understand the pandemic and what their responsibilities were in the pandemic.
Could I attend classes online concerning the RN program specifically? And we have some questions about the application process. We'd love to direct you to admissions for the application process, but Dean Tooley, if you'd like to speak a little bit on how our program works to get folks enrolled and into the nursing track. And then they are asking about classes online.
Okay, as far as classes online in the spring, we're about to wrap up the fall, but in the spring, classes will all be on campus. We will have on-campus labs, on-campus classes, but we will be utilizing social distancing. And so we got this wonderful nursing building, but we will not be hosting some of the classes in it because of social distancing. We're going to have to go to different areas across the campus. But there will be online classes, and as long as clinical lets us, most of the facilities are letting us back in right now, except for long-term care. We're still waiting on those opportunities to occur. As far as applying to the program, highly recommend you get those biologies out of the way, that you focus on your studying in all of your courses and make sure that you get A's and B's in it because you are ranked. It is a competitive admission program. You get points for, let's say, biology. For biology, if you make an A, you get 9 points. If you get a B, you get 5 points. And if you get a C, I think it's like 1 point or 2 points. So the higher your grades in all of your required courses, the more competitive you're going to be. If you do not have taken a medical course before, EKG, phlebotomy, CNA, some of those types of courses, if you take those, then you have certification, you get more points for that. You get more points if you live in Orangeburg and Calhoun counties. And so keep those GPAs up too. You have to know that information because we require those courses because we want you to be prepared when you enter into our programs. We want you to know your math. You need to know the anatomy and physiology because we don't have time to cover that again. So you need to know how to communicate well. So English is very important. You need to know how to understand people. So that's the reason you need to take psychology. So we require our courses for a reason, and we really need you to focus on that to help prepare you. And again, to know it and do well in those courses is going to make you a more competitive person. And a wonderful person I can refer you to is Stephanie Gasson Brown because she handles all of our healthcare prep students, and she does a great job with advising and directing you in the right direction so that you can be competitive and get in our programs. We admit twice for the ADN program. We admit in the fall and in the spring. And for the PN programs, we have admission in the fall. We have several different options. You can move from your LPN. We have the bridge to your RN. Then I work with a lot of your four-year colleges if you are interested in going to the RN to BSN track. So at OC Tech, we have a lot of opportunities for you to get your education.
Awesome. Thank you so much, Ms. Tooley, for that information this morning. But we have to go into our next speaker, but I appreciate your valuable information for our students.
Thank you.
Yes, ma'am. Next, we have Ms. Fran Andrews for Radiologic Technology at Orangeburg Calhoun Technical College.
Good morning.
Good
I
morning.
hope that you're all doing well. I guess I'm the oddball here. I created a PowerPoint. And hopefully all will go well as I talk, and we'll get back to not share screen. So good morning to everybody. I appreciate you taking the time out of your day to join us. Many of the things that have already been said, I think we all go into healthcare because we want to help people and we want to make people's lives better and so forth. And so with radiology, you can see that we do a variety of different things. Many people think that radiology is just bones, but it's far more than bones. So I was asked to talk just a little bit about, what made me go into the profession of radiography. Not only did I want to help people, but I had a hobby of photography. And so along with that, I always wanted to be a teacher. And I first thought I wanted to be an elementary ed teacher. And as time went on, I sort of changed my track. When I graduated from high school, there was not a lot of demand for teachers. So I pursued a different path. I got an associate's degree in secretarial science. I was a year away from getting an accounting degree and decided to go into radiology. So why did I go into radiology? During my first semester of college, I got double lung pneumonia. And so that led to going into many x-rays. And so that was something I was like, well, I like photography. How neat would it be to take pictures of the inside of the body? So I began to ask a lot of questions about x-ray school and decided that that was something I needed to pursue. So just as I was at that year mark from finishing an accounting degree, I worked in a printing shop running a printing press and didn't have a whole lot of, once the press was running great, I didn't have a whole lot to do. So I was sitting there perusing the newspaper one day and saw the ad for radiology school and decided to apply. After applying, I had to go through an interview process and that kind of stuff and was accepted. And so from there, I never looked back. So once I got into radiology school, I began to think about teaching again. And so that was a way that I could take two things that I was really interested in, using the photography as well as my desire to teach, and put them together and pursue a career. So I graduated from radiology school, and the school I graduated from was a hospital-based program, and therefore we worked with students all the time. After graduation, I went to work at that same hospital, and I quickly realized that teaching is what I wanted to do. So I worked in radiology for about 5 years, and MUSC offered a Bachelor's of Health Sciences online. And so off I went to pursue that bachelor's degree because I felt like I needed some additional education. I didn't have any background to teach, and so that was my avenue. Got a great background in that, and once I graduated, there was a job opening at OC Tech as a clinical instructor. So I applied, interviewed, and went to work. I continued to work in the hospital as a technologist for a total of 10 years before I focused on teaching full time. And so you can see I've got sort of a wide background just like other people. I moved from clinical instructor to program director after about 3.5 years and have continued in that position. In 2000, I became Dean of Health Sciences as well as the program director for radiology. In 2010, the college decided that instead of having Dean of Nursing and a Dean of Health Sciences, they would combine the position. And so at that time, I resumed my full responsibilities as radiology program director. In 2007, I completed a Master of Arts in Education from Phoenix University. I did that while being the program director and while being dean. So I more than had my hands full as far as time management and that kind of things. And so time management is extremely important. I've been in the radiology profession for a total of 38 years now, and at OC Tech for 28 and a half. So I was lucky enough to be able to combine both of my interests and pursue a career that I still enjoy today. And so that's enough talking about me. Let's look at radiology and what is entailed in radiology. So a radiologic technologist is a professional who provides healthcare services using radiation as a way to provide assistance in diagnosis and treatment of patients. What do? They use correct positioning techniques and manipulation of equipment to produce these quality images of bony and soft tissue structures. They also perform exams using contrast media to visualize organs and structures. As I said earlier, many people think that radiology is dealing only with bones, but we deal with stomach, colon, kidneys, you name it, vessels. We look in the vascular system and so forth. And so in order to do that, you have to inject contrast. And so that's the only way you can see your stomach and colon and so forth. We also produce images, which are called radiographs of the human body that we use in diagnosing medical problems. We interact with patients by explaining procedures and various positions that are necessary to get those quality radiographs, as well as processing those images utilizing digital technology. With radiology, it's a very communication-based career. You have to be able to explain to your patients, like in other healthcare areas, what you need them to help you do. Your life and their life is a whole lot easier during the process of having x-rays performed if they know what to expect, what you need them to do, and many patients want to help you. So by letting them know that, and communication constantly is the key to a successful exam for both you and the patient. So looking at education and licensure and salary and so forth, graduates of our program are eligible to sit for the official registry given by the American Registry of Radiologic Technologists. Once they pass that exam, they're entitled to use the abbreviation of RTR, R standing for radiography. And so it means registered radiographer. Our gross salary, starting straight out of school, is around $45,000 to $50,000 annually, which on a 2-year program is not very bad. You can progress from there. The associate degree in radiology program, which we offer here, is a stepping stone for other avenues in radiology. You've got computed tomography, or CT. Many people call it CAT scan. MRI, which is magnetic resonance imaging, nuclear medicine, radiation therapy, ultrasound, which also is referred to as sonography. You can also go into specialized procedures where they're doing minor surgical procedures in the radiology department. And so you can be a traveling rad tech. There's a lot of different avenues that you can pursue. And so looking at employment opportunities, you can work in hospitals, outpatient imaging centers, physicians' offices, orthopedic offices, mobile imaging units, outpatient medical facilities, and also travel as a rad tech. Once you receive those credentials from the ARRT, you are, that is your avenue to travel the world and work as a rad tech. So the opportunities are vast, and just like with other health professions, we all have special modalities within our modalities. So people who may go into one avenue of radiology can add multiple certifications behind their name, and each certification carries a different set of letters. Sometimes you may see a rad tech taking your x-rays at I call it alphabet soup. So we can also advance. So what makes a student successful? These are some of our past students who graduated and moved on, and they're working in our radiology lab here on campus. So to be successful, number one, you need to be prepared for class. You also need to be on time. You need to plan ahead and don't wait until the last minute. You need to devote necessary time to your studies outside of class and without interference. Many of our students have families and so forth. And so with that, you have to consider time management. How many hours am I going to be required to be in class and lab? How many hours am I going to need to study after I leave class? Obviously, it's going to be more than you probably had to learn or study in high school. So rule of thumb is about 2 times the number of hours you meet in class and lab per week. This requires you to be able to time management and juggle work and family. Sometimes it's beneficial to reduce your workload in order to be successful in our programs. And so we don't recommend that you work more than 20 hours a week. Some people have gone through the program and worked more than that, but those are your people who don't have outside responsibilities. So plan ahead if you think rad tech is what you want to do so that you don't have to work that many hours. So this is, again, our radiology lab here on campus. It's a fully functional lab. It looks just like one that you go into the hospital with. We have our mannequin here, Pat. She's very flexible, and so the students can know what it's like to work with a floppy patient, one who they can also take x-rays. We've got capabilities of digital images and so forth. And we are very fortunate here. The college has provided us with the avenues to keep up with the technology in the hospitals. And they continue to support us greatly. And it's much appreciated. And with that, our students not only get the hands-on and can work in the lab like they were going to a hospital, but they can also say that they've had that learning experience. Our students go to a variety of clinical sites, and we've changed with COVID just like everybody else has. And so with that being said, our students normally go to clinic their first semester. This semester, we've had to make an adjustment for that. Our freshman students will actually go to clinical starting next semester. Our seniors have been able to go to clinic. And with doing that, we still don't have all of our clinical sites back, but we're working to get new sites, and hopefully everything will open back up. We've also had to be precautious and do some of the same things that Dr. Gary, as well as Ms. Tooley mentioned in clinical and in class and so forth. Our classes have been a combination. We've had students in small groups for labs on campus. The other classes and so forth have been online through Zoom or voice over PowerPoints and so forth. And in the spring, we're hoping to have people back on campus for our classes as well as our labs. And again, they will be social distance in small groups. And we're hoping everybody else is going to be, both classes are going to be in clinic. As you know, the cases are rising, and so we all hold our breath on a day-to-day basis as to what tomorrow brings. But I'm going to go now and see if there's any questions and so forth that I might answer for you. I'm not sure how I'm doing on time, but
Ms. Fran, we do have a question. I have a student asking what you would recommend that they do while they're in high school, what classes they could take to help prepare them for a career in radiology or radiology training.
Okay, so it's very important that you take your biologies and computers and math, any of those opportunities that you have. English, of course, is a big part because we have to communicate. And so you want to make sure that you get your English and biologies and any of your gen eds really out of the way prior to starting the radiology program if possible, because it does require a lot of time and commitment. And if you're somebody who has to work, it may allow you to work a few more hours if you don't have to take the gen ed classes.
That was our main question for you. Thank you.
Thank you.
Thank you so much, Ms. Andrews, for the information on being a rad tech and becoming a rad tech. I see that the other panelists has listed their contact information in the chat box. So if it's okay with you, I ask if you could please put your contact information. So if you have any other questions from the students, they could reach you directly. If the students have any questions for you, they could reach you directly. And finally, if we have Dr. Khalil Demambouran for nursing. He is the Women's Health Medical Director at Colleton VA Healthcare System. And I want to turn things over to him, the presentation over to Dr. Demambouran.
Hey everyone, I'm going to take this headset off because I'm kind of in two different meetings. So I just got called to an impromptu meeting, but I definitely want to be here available. So can everyone hear me? Raise your, okay. All right. So I'm Dr. Khalil Demambouran. I am a women's health nurse practitioner. I noticed yesterday that my slide actually said Doctor of Nursing Practice. So I just want to share that Doctor of Nursing Practice is kind of like a misnomer before we even start. And this is just in transparency. So I just want to say that a Doctor of Nursing Practice is a degree. It's not an actual nursing role. So I'm coming to you from the nursing perspective. I am a women's health nurse practitioner. I am a medical director, but there's no such clinical role as Doctor of Nursing Practice. So I want to make sure that's clear. I think that's an exciting degree to have, but it's not a degree that, so my title is doctor, but it's not a degree. So I'm in the middle of my very busy work day. So this is kind of what you can expect when you're a nurse or a nurse practitioner or a medical director. I get plenty of calls on the fly. So my boss, who is my chief, just actually invited me to a meeting. And so she, nurse practitioner, there you go. All right, thank you. My boss just called a meeting, and so we're talking about measures. So let's talk about the nursing career and the nursing, my path as a nurse. So I've been a nurse for about 30 years. I've always taken care of women. I hold a multiple board certifications. So I've spent about 10 years in labor and delivery. That's what you see the RNC OB is. So I'm certified in obstetrics. I'm also board certified in women's health as a nurse practitioner and as an adult nurse practitioner. I am a fellow in the American Association of Nurse Practitioners. And actually, if we can add a comma and a space and a FAAN on the end of there, I just was inducted into the Academy of the American Academy of Nursing last week. So I'm pretty excited about that. That's one of the highest honors you can achieve as a nurse in the United States. My role, so how did I start out in nursing? I pretty much knew, just like maybe many of you know, that's what you want to do as a physician. You as a I don't want to say a job, because I always don't try to point individuals into coming into nursing just because it's a job. I suggest that you come into nursing because it's a career, you have a passion for nursing, but not like it's a job, like you could go to McDonald's or you could go to Burger King or Walmart. Not saying that those aren't good jobs, but I think nursing is more so from it's a career. And so if we kind of look at it from a career perspective, you have to kind of start off with obviously a certain educational path. The recommended educational path that I would say is that take as many science classes as you can, and that would include botany, zoology, biology. You're going to have to really be heavy and dense in the science education. A lot of times, though, when we talk to students and we talk about potential healthcare providers, is that we don't remember to suggest that you want to do volunteer work. So you want to be really heavy on volunteer work, not just in your academic work. And what I mean by in your volunteer work, I mean, like, say if you were, say there's a nursing home down the street or in your neighborhood where Thanksgiving comes, and you can go help just volunteer your time there, volunteer on a committee that has something to do with healthcare. These are the kind of things that when I look at an applicant, and I, whether it be coming into a fellow program or a job applicant, I want to kind of know what they did with their own time, not, the forced time when they had to go to academics, but I want to know that they take the initiative to want to help someone by themselves. And I say that because you'll find as you go into healthcare, we really spend a lot of time like after hours. It's not really like a 9 to 5 kind of role. You kind of leave, you go home, you kind of still have to think about patients. If you're in a family, I'm married, I have 2 daughters, my wife is actually a physician. We take care of patients all day and we take care of patients every day. That means when Thanksgiving comes, somebody might be at the hospital taking care of a patient. When Easter comes, that means that, we're not running around looking for eggs. We might have to be taking care of a patient. Christmas time comes, so we might, have to miss Christmas time. So keep that in mind as you come into healthcare, that there's sometimes a challenge in what we call the life-work balance. It's kind of difficult to manage that sometime. And even after 30 years, I'm still learning how to reach a great life practice balance. But I do want to say that, so that's kind of what you want to think of up front. Think about you're going to have to be committed to a long haul nursing academic work is really difficult. It's rigorous. It's stressful. You might have to do away with some things in your life. Like say I played sports early. I didn't get to play sports when I was a student because I was like at the hospital or I was doing this. I didn't really date a lot because I was busy doing other stuff. So anything that's going to be distracting you, you might want to get that off your plate up front. Just, hey, I'm going to put that over here for 3-4 years, get this degree, get into my career, and then you can catch up with those kind of things on the back end. I started out, I knew I wanted to take care of women. So I started out as an OB nurse, med-surg GYN, and I don't even know how I knew that I wanted to take care of women. I just got it in my head when I was 15 that I wanted to take care of women in a non-medical way, but in a nursing way, which we kind of look at as different. We kind of care more in terms of nursing. And so I went to nursing school, and my first job out was med-surg GYN. Did that for a couple of years. Then I did antepartum, postpartum nursery, newborn nursery for a couple of years. Then I did L&D for about 10 years. So I was an L&D nurse for about 10 years, delivered a lot of babies. Well, the babies actually, I didn't deliver them. They kind of come out on their own. They just come out. You're just kind of like hanging out to help. And then I became a nurse practitioner. And so I've been doing in that role. I think it's a rewarding career. There's a lot of avenues. There's a lot of ways you can go into different branches. You can go to administration. You can go into administration, you can go into clinical practice, you can go into leadership roles, you can go to policy. So there's many avenues as a healthcare provider, as a nurse, where you can go to. It's not just limited to bedside nursing. And I think that's one of the true attributes of the position or the role of a nurse, is that there's such a plethora of direction in which you can go to serve. And we try to serve humanity. So that's why I was alluding to, don't just go into it because it's a job. Go into it because you want to take care of humans. There's sad days, there's good days. But your job is to give whatever you have as a human to other humans to help them be better in their healthcare. Sometimes that's hard. You got to kind of sit and cry with folks, and you know, it's not a good day. So I'm checking back. Yeah, I'm just checking back in my meeting. I'm sorry. But those are the kind of things that you want to think about as you go into your career. It's a very rewarding career. My children are actually going into healthcare. I have two daughters, and they've gone into healthcare. So I would really suggest that you go into healthcare. I'm going to leave my email in the chat box. And I want to say, if you have any questions at all, I'll take some questions here. But if you have any questions at all, you know, that you think about later on, you can think about like email me and just let me know. Okay, I'm just checking. So that's my email. So right now I can take questions because I know I only had 15 minutes and I don't want to stand here. I could stand here and talk about nursing forever, but I don't want Miss Green to come get me because I still got to see these patients for the rest of the day. So
a few questions for you. One's
okay.
asking, how long does it take to become a nurse practitioner? Maybe they're speaking directly to what's the course of study to finish with that NP degree?
Okay, so for a nurse practitioner degree, first you have to go for 4 years of regular nursing program. So that's usually like 2 years of the sciences. Then you have to go 2 years of what we call upper division, or when you really take like clinical courses, when you like go put your hand on patients. Yeah, so so then after that, you have to apply for nurse practitioner school. And it takes about 2-3 years, depending on your specialty, to go to nurse practitioner school. Some people elect not to work. If you can work, but we kind of like physicians, we kind of say that, kind of discourage you from working because, again, you want to really be concentrating on your work as opposed to being distracted by, your employment. So I'd say at a minimum, it takes about 7 years. You just want to commit to 7 years. If you want to go post nurse practitioner and you want to go to doctoral level, that'll take another 3 to 6 years. So all in all, I can't even remember how long I've been in school, but I was an associate degree nurse. So I went 2 years 2.5 years as an associate degree nurse in the hospital. Then I went another 3 years as a baccalaureate nurse. Then I went another 3 years as a bachelor nurse. Then I went another 3 years to get my doctoral degree. So I have 4 nursing degrees. So it takes a little time.
Another question is, can you tell us a little bit about the duties of a nurse practitioner to that of the duties of a nurse, how they differ?
Okay. So as a nurse, you pretty much are more, and most of nursing is done in acute care facilities. Acute care facilities we recognize are hospitals. As a nurse practitioner, your role is a little different. As I actually write, diagnose, and pretty much see my own patients. So the patients I take care of, so I bill for that care. I make the decisions on those patients. I collaborate with nurses, registered nurses. I collaborate with physicians. I collaborate with physical therapists every day. I collaborate with pharmacists every day. But my role is really like the gatekeeper as a primary care provider of women. And again, I write my own prescriptions, so I do have prescriptive authority. And that's kind of why you have to go back and get the additional education. As a nurse, you really wouldn't write, or generalist nurse, RN, you really wouldn't write the orders. You can definitely write nursing orders and nursing diagnoses. I, in my role, actually deal and make medical diagnosis. But again, I want to be clear that my role is not a physician or not doctor of nursing practice. That's my degree. My role is nurse practitioner. So that's kind of like some of the differences there. It's pretty much the difference is that I manage my own cohort of patients and I'm responsible legally for those patients. And that's a good question, by the way.
Okay. Awesome. Thank you so much, Dr. Demonbron, for everything, for stepping in and speaking to our students this morning. You did an amazing job. And we know
Okay, you guys got more questions?
I'm not sure.
I've referred your email to a few students who had some specific questions about.
No, actually, it's, Nettie, were you asking me a question?
I'll have the students refer, I'll have the students.
I'm sorry, I thought they were asking a question.
Oh,
Yeah.
no, you're fine. I'll have the students send their remaining questions to your email address in the chat box.
Okay, thank you so much. Thank you for allowing me to spend a couple of minutes with you. As you'll see, when you come into a healthcare career, it's pretty dynamic. You have to be flexible. Things happen, like people change schedules. And so patients, because you're dealing with human, you have to be pretty flexible. Just like today, I was all set at 11 o'clock and then this meeting got called. So thank you again and good luck in your careers. You're working, the AHEC is such a great organization. I actually sat on the board of the AHEC about 10 years ago. I didn't know if Ms. Green knew that.
So,
on the board.
My
Yeah.
director,
Thank you.
Yes, sir. Thank you so much.
All right.
All right.
Okay, bye-bye.
Bye. In conclusion, I want to thank each of you again for your time taken from your busy schedules this morning to provide our students with that valuable information. Following this meeting, I will send out a thank you email requesting a mailing address where I can send you a token of our appreciation for your time and dedication to our Bench the Best Side 2.0 program. To our participants, thank you for your participation and involvement in our symposium this morning. I hope that you each could use this information going forward in your health career journey. I want to say thank you to Stephanie Brown for the logistics and her hard work and dedication behind the scenes bringing this program together. And I also want to say thank you to Ms. Regan Blanchard for stepping in and doing the questions for us this morning. You did an amazing job. And I want to, if y'all have any words that you want to give or say to the students right now, that'd be awesome.
We have one more question from Miss Marlena Isaac. She'd like to ask live. I've given her permission to speak. So Miss Marlena, if you'll pop in. Oh, let me ask her to unmute again and see if that helps. I know she's, oh, there you are. Miss Isaac. Miss Isaac is a program coordinator at Aiken Tech. I think she had a question for us. Hi, Miss Isaac, you're live. We can hear you, Miss Isaac, if you.
Well, before we close, I just wanted to say a few words. My name is Stephanie Brown. I'm the Dean of Healthcare Preparation and Workforce here at Orangeburg Calhoun Technical College. And if you all have any questions about any of our programs, please feel free to give me an email or a phone call, and I can try to answer those questions for you. I know we're gearing up for our application season that's going to start in the spring for all of our programs, physical therapist assistant, radiologic technology, the associate degree nursing program that leads to RN, LPN that leads to practical nursing, and medical assisting. All of those programs will start accepting for in the spring. So if you have any specific questions about that, please shoot me an email, and I think it was posted in the chat. So don't hesitate to reach out.
Awesome. So this concludes our Fall Health Career Symposium. And I want to thank you all so much again.